On the first day of his second term in office, President Donald Trump began the process of withdrawing the U.S. from the World Health Organization.
What is this one?
Withdrawing from the World Health Organization, sir?
Ooh, that's a big one.
The Director General of the WHO says withdrawal may damage public health around the world while also putting the U.S. at risk.
The U.S. cannot be safe unless the rest of the world is safe.
The WHO helps countries detect, study, and react to threats, including pandemics, by sharing technical expertise and coordinating responses like testing and vaccine distribution. The U.S. will no longer participate in that global system. Dr. Georges Benjamin is executive director of the American Public Health Association.
Creates a void and the inability for us to coordinate on a global scale. And, the important thing to understand about particularly infectious diseases is that they do not respect geographical boundaries. And we travel at the speed of our transportation systems, which is, hours.
The U.S. withdrawal from the WHO comes as the Trump administration has also cut billions of dollars in domestic public health spending.
We worry very much because the core infrastructure of public health has been decimated in the United States. But at the end of the day, the national government's responsibility is to protect its citizens and to ensure that the infrastructure and capacity is in place to do that. And as a nation, at least the United States right now is failing, not only the United States, but we're failing the rest of the world as a global citizen.
The consequences could be serious in the U.S. and abroad.
It will cost lives, not just American lives, but lives all over the world.
The WHO hopes the U.S. will reverse its decision.
I hope the U.S. will reconsider its decision and rejoin WHO. Withdrawal from WHO is a lose for the United States, and it's also a lose for the rest of the world.
But Dr. Benjamin says even if Trump or some future president were to bring the United States back into the World Health Organization, it could take years to rebuild the U.S. public health system and reintegrate into the global health community. Jim Spellman, CGTN, Washington.